Starting Monday, there are new travel restrictions for people coming from the United Kingdom because of a new, more highly contagious strain of the coronavirus there. The CDC is now requiring anyone flying from the UK to the US to show they've tested negative for COVID-19 within 72 hours of their departure. Federal officials say due to travel restrictions in place since March, air travel from the UK has been cut by 90%. This comes as the American death toll for COVID-19 nears the 330,000 mark. Johns Hopkins is reporting overall cases in the U.S. have surpassed 18.6 million. Meanwhile, experts warned the months ahead could be some of the darkest since the pandemic began. California is being hit especially hard. More than 2 million people have been infected there, filling some hospitals beyond normal capacity. Many facilities are also reporting they no longer have ICU beds for sick patients. Joining us now is Dr. Bob Lahita. He's a professor of medicine at New York Medical College and chairman of medicine at St. Joseph University Hospital. Dr. Bob, thank you so much for taking the time to chat with us. Merry Christmas. Hospitals have reached or are reaching...
Merry Christmas, Tom.
Merry Christmas to you too, sir. Hospitals have reached or are reaching ICU bed capacity in several states. This comes as public health officials fear a massive post-holiday coronavirus spike on top of the one that the nation is already seeing. Realistically, what can we expect to see in the coming days and weeks with this virus? And is there anything we can do now to mitigate another surge?
Yes. Well, what we can do now, Tom, is do what we've been telling everybody to do over the past 6 months. Unfortunately, every holiday is clump time. And I say clump time because what happens is people clump together in either family outings with good friends or sharing food. They may be asymptomatic, but they may be infecting everybody around them. So it's a really dicey time. And we saw this surge after Thanksgiving, and we're preparing for a major surge after the Christmas holidays, Christmas and New Year's in particular. Tom?
And Dr. Bob, I mean, the thoughts that must be going through your mind when you're seeing these airports just packed to the brim. I want to talk about this mutated COVID strain out of the UK. On Christmas Eve, the CDC announced that anyone flying from the UK needs to have a negative COVID test before their flight, but many other countries banned or restricted flights from the UK within days of learning about the new strain. Will the CDC's new mandate help protect the U.S., or is it a matter of too little too late? We do know that this strain was discovered all the way back in September.
I think it's maybe too little too late, like you say. I believe that the strain is already present in our country. And the interesting thing is that we shouldn't get very, very excited or hysterical about the strain because there are 23 mutations. That's what viruses do. They mutate. And it's well known. Say, you know, everyone knows that the flu virus mutates routinely every year. It's endemic, and that's why we get different shots every year. But this is 23 mutations. 17 of them are significant. 8 of them involve the spike protein. Now, for your viewers, the spike protein is the way that the virus sticks to receptors on cells and how it infects you. So one of those increases the binding of the spike protein to the receptor. That means that it's a little tighter bind, which means that you probably need less virus, less load to infect you. And that's why the Brits are saying it's more infectious. That variant has even got a number. For N501Y. It has been carefully looked at in the laboratory, and people are not crazy about it, but they're just being very, very careful. And I'm sure it's It
appears that we've lost connection with Dr. Bob Lahita. Oh, he's back. Dr. Bob, are you back?
I'm back.
Oh, okay, good.
Yes, I'm back.
We lost you there for a second. You were talking about the variety of strains. And you know, I guess just kind of jumping off that for a second, I'm so curious. We are seeing this surge, this massive surge in places across the country. The country looks like it's on fire practically. Do you think that this new strain, this variant that's way more infectious could also be contributing to the surge that we're already seeing in this country? I know that research is probably really difficult to decipher at the moment.
Well, that's pretty difficult, Tom, to ascertain because we would need molecular testing. And as you know, molecular testing is the most sensitive testing because it looks actually at the genome of the virus, the RNA of the virus, and it tells where these mutations are located. And as I mentioned before we broke away, perhaps in lost contact, was there's only one mutation out of 23 that is concerning, and that involves the stickiness of the spike protein to the receptor, which means you might need less virus to infect a person than is usually the case. So that's the only concern about the strain. And perhaps some of these spikes are because of that, but I suspect that the reason for the spikes are more that people are getting together and being closer, not wearing masks, and not socially distancing. Tom?
We always appreciate your insight, Dr. Bob Lahita. Thank you so much for your time, and Merry Christmas to you, sir.
Merry Christmas to you, Tom.